Steve, you use a really good example of this. You talk about buying bread at a grocery store, but healthcare is one of the only services that we purchase that we don't know the price before we get the service. Can you talk a little bit about that analogy and expand upon that?
Yeah, it's. I'm glad you called it good. I feared that I say it and people go, "What's this guy talking about?" But the analogy I like to use is buying healthcare is kind of like going to a grocery store. And imagine you walk into that store, you walk down the bread aisle, and you notice that all the bags of bread are blank. They have no labels on them. They have no pricing on them. And so you think, all right, well, I'm going to grab this loaf of bread. You think it's wheat bread, but you're not really sure. And then you walk up to the cashier and you ask the cashier, hey, is this bread any good? Cashier looks at you and says, I think so. Should be. We'll kind of let you know down the road once you try it, but it should be. You go, okay. Well, how much does the bread cost? Cashier quickly says, well, what kind of credit card do you have? And you hand the cashier your MasterCard as an example. He or she swipes it, hands it back to you and says, great, I'll let you know in about 1 month how much your bread costs. That's how we all buy healthcare, right? We walk in without necessarily knowing the quality, and we rarely ever know how much it costs. We almost never know what it costs until we get an explanation of benefits or a bill a month later. And again, it's nobody's fault. It's just what the industry's created. And at Pareto, we're trying to help peel back the layers there to help individuals utilize the healthcare system properly so that they don't have to go out there blind, right? Because fully insured companies today, when they give their employees an ID card, it's like giving them a credit card to go spend anything they want in the healthcare system without ever knowing. And it's a big, big, big reason why costs are going up so much. So at Pareto, we have a number of different programs and vendors and services included with our membership, of which we're going to continue to add on to, that members can use to help their employees do what we call navigate the healthcare system better. Help employees get to the highest quality facilities with the lowest possible cost. Because in our opinion, that is how you actually control the cost of healthcare.